Hello everybody, welcome to my channel. This is a pathology video on hepatobiliary pathology. This is the second in the series of videos on cirrhosis. The topic is etiopathogenesis of cirrhosis. This is by Dr. CSBR Prasad, Professor of Pathology, Sri Devaraja's Medical College.
And coming to the causes of cirrhosis, alcoholism is the topmost cause for cirrhosis, and 60 to 70% of the cirrhosis has got alcoholic etiology. And in addition to that, there may be viral hepatitis, especially chronic viral hepatitis, may be associated with development of cirrhosis. Among them, hepatitis B and C are known to cause cirrhosis in the liver. And biliary diseases 5 to 10%. Others like primary hemochromatosis, Wilson's disease, alpha-1 antitrypsin are very rare. And cryptogenic cirrhosis, where etiology cannot be clearly made out, constitutes a considerable chunk of cirrhotic cases, that is 10 to 15%. And you see this one, this patient suffers from cirrhosis of liver. One of the manifestations of cirrhosis is the alcoholism. This patient suffers from cirrhosis of liver. You can see the pot belly due to ascites, and the etiology is he was an alcoholic. The pathogenesis of cirrhosis, to understand better, you see the normal liver contains type 1 and type 3 collagen in the portal tract and central vein. In the case of the hepatic sinusoids, you will find type 4 collagen. When the normal liver becomes cirrhotic, type 1 and type 3 collagen are deposited in the liver lobule. That means the hepatic sinusoids, you will see this type of type 1 and type 3 collagen instead of type 4. So this type of collagen deposition and the excessive deposition of collagen is due to the irritation of one cell, that is Ito cell. So if you look at the normal so this slide represents the normal appearance of the liver histologically on the left side, and the liver in the case of cirrhosis. So if you look at this normal histology, blue area representing the sinusoidal lumen, and towards the lumen you are finding flat cells known as endothelial cells. In between the endothelial cell, there is a Kupffer cell, which is represented by green cell. And below, these orange cells are the hepatocytes. And in between the endothelium and the hepatocytes, there is a space. And in this space lies a cell known as stellate cell. This stellate cell is responsible for synthesis of collagen, and which is of type 4 collagen. So this space in between the endothelium and hepatocytes are known as the space of Dicey, and in the space of Dicey you will see the presence of this Ito cell and type 4 collagen. So when the Ito cell is irritated due to some reason, the factors I will enumerate later, and it starts multiplying, so this number of Ito cells is increased, and it synthesizes in excessive quantity type 1 and type 3 collagen, which gets deposited in the space of Dicey. With this progressive deposition, there will be encroachment onto the normal hepatocytes, and there may be what do you call that a pressure type of necrosis, and there will be loss of hepatocytes in this area. And this stellate cell not only synthesizes the collagen, and it exhibits certain properties like the contraction. So because of this contractile property, it is equated with myofibroblasts. So the stellate cell irritation, when it is irritated, it becomes a myofibroblastic variety of cell, which has got in addition to synthesis of collagen, it also has the capacity to contract like a muscle, smooth muscle, and it has got the capacity to divide, and it produces lots of collagen. So what is responsible for proliferation of this Ito cell the cytokines liberated due to inflammation or other processes. So, what are these cytokines? PDGF and tumor necrosis factor. And other cytokines like MCP1, PDGF, and transforming growth factor beta is also responsible for initiation of multiplication and excessive deposition of collagen by the Ito cell. So overall, the Ito cell is the one which is responsible for fibrosis in the liver, and whenever it gets irritated, it synthesizes, it multiplies and synthesizes lots of type 1 and type 3 collagen. So, what are the irritants of Ito cell? It can be a toxin, say for example, this aflatoxin, A1 aflatoxin derived from the Aspergillus, or it may be due to any chronic inflammation like occurring in chronic hepatitis due to B or C viral infection, or drug-induced hepatitis, wherein there will be liberation of cytokines like tumor necrosis factor alpha, transforming growth factor beta, and interleukin 1. So they irritate the Ito cell. In addition to that, any cell injury, any cell that gets damaged, either the Kupffer cell, or it may be endothelial cell, or it may be hepatocyte, or a bile duct epithelial cell. So whenever there is injury to these cells, the liberated contents may irritate Ito cell. And disruption, anything that causes disruption of extracellular matrix may also produce an irritation to the Ito cell. Ultimately, these irritants, chronic inflammation, toxins, liver injury, and also this disruption of extracellular matrix ultimately produces what is known as excessive fibrosis secondary to irritation of Ito cell. So clinical features, most of these patients may be asymptomatic for a longer time, and they may have anorexia, weight loss, weakness, and there may be osteoporosis in long-standing cases, and debility because of associated complications.
Thanks for watching. Please subscribe by clicking the button subscribe.